আসসালামু আলাইকুম। আজকে একটা সুন্দর দিন। আমার পাশে রয়েছে নওমি। তিনি পাবলিক হেলথ সেক্টরে উনি কাজ করছেন, লেখাপড়া করছেন। তিনি পাবলিক হেলথ নিয়ে বাংলাদেশে উনি কাজ করতে চান এবং আমি নওমিকে এর কাছে জানতে চাইব যে এই বিষয়ে তার বাংলাদেশকে নিয়ে কী ধরনের পরিকল্পনা, এবং কেনিয়া বা আফ্রিকাতে উনি অলরেডি কিছু কাজ করেছেন এবং বাংলাদেশকে সাথে করে নিয়েও এখানেও আমাদের পাবলিক সেক্টরে অনেকে কাজ করছেন, তাদের সাথে কোলাবোরেশনে আমরা কিভাবে কাজ করতে পারি এই ব্যাপারে তার কি ধারণা সেটা আমি জানতে চাইব।
আসসালামু আলাইকুম, আমার নাম হলো Nomi. So currently, পুরো জিনিসটা ইংলিশে বলবো because আমার বাংলা এত ভালো না, নিউ ইয়র্কে বড় হয়েছি. Currently, I'm a student at Tulane University doing my master's in public health under international health and sustainable development. So a lot of my focus is on sustainable development, which is to ensure that whatever aid you end up bringing in a community is sustainable, that they can continue for generations to come. One of my main interests, working in Tulane University and with the university as a whole, is to work with amputees because my brother is an amputee himself, and I've noticed a lot of health equities that are in relation to disabilities in developing countries. So that's actually what led me to work in Sierra Leone, because they have thousands of amputees currently because of the civil war that had occurred and ended in 2002, and they've created a community who work together to kind of bring aid and share aid amongst their community. And I went in hoping to learn from them, but I ended up gaining a far bigger interest in socially innovative tools and methods on how we can address these social issues that surround disabilities. So while I was there, I met with the Amputees and War Wounded Association, and they were all individuals who were impacted negatively by war, and they faced a lot of atrocities. The amputees were forced amputees, meaning that the rebels had amputated certain limbs. And there were other groups that were included in the organizations, such as rape victims, orphans, and just anyone that was wounded by the war. It's the largest organization within Sierra Leone that does aid the war and wounded community, but that doesn't mean it's the only organization, but it has the most people that are currently registered. So that's the organization I work with directly and the most, and we work together to do a needs assessment and stakeholder mapping to kind of determine what the next steps are in gaining, or the next steps are in advocacy efforts and how to gain support with stakeholders outside of Sierra Leone. That led to the creation of their website, which is something that they didn't have. We are so used to having technology surround us nowadays, but Sierra Leone is still a country that's very behind when it comes to technology. So this organization that's existed since 2002, if you look them up, all you would find is a 2-sentence bio about their organization. That's it. You can't contact them. You can't reach out in any shape or form. Their address is literally across the new market. So it's even having things shipped to them is just not feasible at the moment. So we were faced with a lot of unique situations that you wouldn't really have to work with in other nations, in more developed nations, even in Bangladesh. You know, we have these methods, like we have people creating websites. My uncle's here and he does a bunch of that stuff. But this was something that just was so rare back in Sierra Leone. They contacted one another through WhatsApp, you know, so they're quite behind, and this is where we've stepped in to kind of bridge that gap to help bring in more international aid, and we can do that by creating a website. So that's what we ended up doing, and through that whole process, I did learn a lot. A lot of these situations, everything that we learn in university in our classes, when you actually put it into practice, there are a lot of questions that do pop up because theory can't be applied as easily as we would hope for it to. So like the issues I mentioned about shipping, like how can we create a sustainable income for Sierra Leoneans when they can't ship a lot of the products that they could potentially manufacture within the community? Or how can, if roads don't exist, how can people with wheelchairs actually move around safely? How can you get access to healthcare? There's all these questions that in a utopic world we would have the answers to, but in Sierra Leone these answers don't exist, and you have to start in really small steps and just from all different angles to be able to kind of bring that aid and advocacy to amputees. So that experience also highlighted a lot of the discrimination that amputees and anyone with disabilities that are visible face, and that's something that's very present in Bangladesh as well. We went 10 years without visiting Bangladesh due to my brother's accident, which led to his amputation. And when we started to come back, we noticed the health equities that people in his situation face. Their places aren't easily accessible. There isn't a ramp in most places for wheelchairs to go up. There's a lot of stigma around disabilities, such as belief that it was caused, but it's due to a deed that was bad, done in their life in the past. There's a lot of misconceptions when it comes to disability. So that's where I want to start focusing my work on in Bangladesh, kind of changing that mindset. And this is like a very slow process because this is generations of like mentalities, beliefs that have been passed down that you're working with. But it is possible because it's been done outside of in different nations. But it will take time and it needs a lot more awareness, and that's kind of where I started with Sierra Leone, creating the website, having these difficult conversations, even doing this whole show that we're on right now. Just having these conversations and making people more aware of the issues that exist, because unless we talk about it, it doesn't exist to most of the world. So that's where I would hope to start when I do bring my work to Bangladesh. And I've already started these conversations. There are amazing connections when it comes to Tulane University. It's the first public health program that was ever created. So their connections are strong and they have a very wide range. And my goal is to start connecting Bangladeshi staff. So we have discussed faculty members to do lectures at Tulane University to bring awareness, like to bring interest from faculty and students to continue to work here, because they can do good. But we need visibility. And that's actually something that was brought up while I was in Sierra Leone. I asked each one of my focus groups, what would you want me to do for you? Like if you could have me do anything specific for you, what would it be? They all said, take pictures, take videos, share our stories, because seeing is believing. So if you don't have direct contact with Sierra Leoneans who have been impacted by war, you're not going to believe what they're experiencing, right? So the same goes for Bangladesh, right? Like we would want to connect Bengalis, people who are in need, and to people like the professors in Tulane University who already have the connections and the stakeholders that can potentially help and learn from Bangladesh itself, and easy, simple, which is why it would be amazing if we could get some professors from here to actually lead the lectures within Tulane University, because they can provide a more realistic expectation or perception of what's actually going on and what's needed and what's feasible and what's not. Yeah.
Thank you very much, Naomi, for your very informative information on the public health and your experience on Sierra Leone, and as you expressed to work in Bangladesh. And Bangladesh, as you know, Bangladesh Open University had the largest network in the academic field. We have 12 regional centers and 80 sub-regional centers, and we can go to the all ends of Bangladesh. And we have the largest network, as I said. So we can collaborate with you, and as you said, we can implement this program on public health to develop a consciousness among the poor people to have a good on the public health. And I hope in futures we will have a positive attitude on these issues, and we can have a memorandum of understanding with your institutions, and we can work together.
Just based on like creating those connections and MOUs, it's just a reminder how interconnected all of these subjects are. Like even the professors that you had recommended for Tulane University, looking at their background, it's vast. You know, they can work in geology but have an interest in international health because all of it's connected. So it's with that collaboration that we can ever think of making a difference. Without it, everything's one-sided and it's messy.
Thank you very much.